Welcome to my channel. Whenever a doctor is consulted after pregnancy, the doctor usually recommends ultrasonography. At that time, many questions arise in people's minds. Do repeated ultrasound during pregnancy do many harm to the baby? How many times should a pregnant mother undergo ultrasonography during pregnancy? Many people ask me this question. Let's discuss in today's video. How many times should an ultrasonography be done during pregnancy? What harm does the baby suffer in ultrasonography are done frequently during pregnancy? So let's get started. What is ultrasonography? Ultrasonography is a type of examination that uses a special sound wave to create images of the internal part of the body. These images appear on the computer screen and used to identify various problems, which is essentially called ultrasonography. Sometimes this stage is referred to as sonography, an ultrasonic scan or ultrasound. How many times should an ultrasound be done during pregnancy? A pregnant mother should undergo an ultrasound at least 3 times throughout her entire pregnancy. Sometimes more frequent examinations are advised depending on the situation. However, it is recommended to have it done at least 3 times. When and why should it be done 3 times? Let me explain. First, ultrasound. Generally, it is advisable to have the first ultrasound between 10 to 12 weeks of pregnancy. If an ultrasound is done before 8 weeks, many times accurate result may not be obtained. So, ultrasound examination during this time are extremely urgent because the first ultrasound provides quite bit of information. For example, normally after conception, the fetus settle in inner part of the uterus called endometrium. But if for any reason the fetus settle outside of the endometrium, it is called ectopic pregnancy. This is a dangerous condition. In an ectopic pregnancy, the fetus cannot survive after a certain period of time. If not treated in time, it can also endanger the life of the mother. After conception, when the fetus settles in the uterus, a space is formed for the baby, which is medically termed fetal sac or fetal pool. Many times it is observed that after a positive pregnancy test result, the fetal pool is also formed, but the baby is not present inside. Alternatively, even if the baby is present, there is no heartbeat, which is medically termed blighted ovum. If there is no heartbeat within 12 weeks, then the pregnancy cannot continue and miscarriage may occur. Additionally, it can be understood whether there is developing baby in your uterus. Your gestational age and estimated delivery date can be determined, whether the baby is growing properly, whether the baby's spine and brain are developing normally. All this issue can be understood through an ultrasound done around 10 to 12 weeks of pregnancy. The second ultrasound should ideally be done between 18 to 22 weeks of pregnancy or around 5th month of pregnancy. Sometimes this ultrasound is referred to an anomaly scan. Even if an ultrasound has been done at least once during pregnancy, it is advisable to have it done at this time. During this scan, many specific information can be obtained, such as whether the fetus has any congenital abnormalities, whether the fetal anatomy is developed properly, whether the fetal growth is progressive at a normal rate, whether the size and weight of the fetus are normal, whether the fetus is boy or a girl, whether the fetus is in normal position in the uterus. All this information can be obtained from an ultrasound done at around 5 months of pregnancy. The third ultrasound should be done between the 36 to 38 weeks of pregnancy. During this scan, the position of the baby and placenta can be observed before delivery. Having this scan makes it easier to decide whether a normal delivery or a cesarean delivery will be performed. Many pieces of information can be obtained for these scans, such as position of the placenta. The placenta provides all the necessary nutrition for the babies during pregnancy. Usually, the placenta is positioned on the upper part of the uterus. However, if the placenta is positioned lower than normal, it is called low-lying placenta. Additionally, it can be indicate a serious complication called placenta previa. If there such a problem with the placenta, a normal delivery becomes risky. In such a case, special preparation may be needed for delivery with help of cesarean section. I have a detailed video about low-lying placenta on my channel, and I will provide the video link in the description box if you want to watch it. Position of the baby. Typically, by the 36 weeks of pregnancy, preparation begins to deliver. At this time, if the baby head is positioned downward facing the birth canal, it is called cephalic presentation. However, if after 30 weeks the baby is positioned with the buttocks, feet and head not downwards but upwards, is called breech presentation. Please look at the image. If by the 36 weeks the baby is not cephalic presentation, normal delivery may not be possible. In such a case, cesarean delivery may be necessary. During pregnancy, the baby resides inside a fluid-filled sac called amniotic sac. This fluid is called amniotic fluid, and during ultrasound, the amount of amniotic fluid surrounding the baby in the uterus is mentioned. If the amount of amniotic fluid is too much low or too much high, it can be indicate complication in the pregnancy and may lead to problem with normal delivery. Additionally, it is observed whether the baby is moving properly inside the uterus. This is why it is advisable to undergo ultrasound at least 3 times throughout pregnancy. However, if there are any specific concern, it is advisable to consult and possibly undergo ultrasound more than 3 times. Next question. Do repeated ultrasound during pregnancy do any harm to the baby? The answer is no. Frequently, ultrasound scan during pregnancy do not cause any harm to the baby. This is because ultrasound imaging used to sound wave and it does not involve any harmful radiation. Therefore, frequent ultrasound do not cause any harm to the pregnant mother or the baby. So, I hope today's video was helpful for you. If you find the video helpful, do not forget to share it with your friends. Please subscribe to the channel to get health advice, health awareness and reproductive health related all the videos, and remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.